month of Ramadan. So we have to start with no water.
Yes.
So in all our other podcasts, we had something to drink, but in the month of Ramadan, no doctor, no.
Okay.
Assalamu alaikum, everybody. We are back again with an excellent actually surgeon, Dr. Erman Menekşe, who has recently joined us. He's a very talented plastic and reconstructive surgeon. And I think I cannot say enough beautiful things about him. I think we'll just say, welcome to Clinichub, Doctor.
Thank you. It's your welcome.
Thank you very much. I think we are very curious about you. And the viewers will want to know because, you know, Clinichub has been a company for about 8 years. We had talented surgeons delivering excellent results. And now, obviously, with your talent, you are partnering with Clinichub. Who is Dr. Erman Menekşe? Just briefly.
Yeah, sure. I'm working as a plastic surgeon almost 10 years. I just started my residency at 2015 and finished after 5 years. Then I'm working as a plastic surgeon for myself for 5 years. And I'm working for the government first 2 years. We are doing aesthetics, also some reconstructive surgeries, some traumas and like hand surgeries. Too many complicated processes, as you know.
Of course, in Turkey it is.
Yeah, like emergency calls, too many in other cities works, too many surgery we did. But after 2 years, I'm focusedly just aesthetically procedure, as you know, and body control.
Do you like it or the money is better?
Both of them. Because in aesthetic procedure, as you know, it's not only for medication. We are changing the life.
Exactly. This is not something that they must do because it is something that they want to do.
Yeah, we are touching the lives. You know.
Exactly.
Yeah. Then after our patients get more happiness with the procedure, and we are sharing them with them and better experience.
Exactly. What is your most, for example, which procedure out of, because as a plastic surgeon, let's go through the list of surgeries that you are talented to do. So let's start from the head and then we can go all the way down, down. So from the head, can you do these earlobes?
Yeah, we
I think my earlobes are too big. I always say that. Anyway, so anything regarding the face, so that's...
We are doing all aesthetic procedures.
Okay, let's name them.
Yeah.
For example, start from the hair. Hair transplants, you are able to sign because
Yes.
in the Turkish medical system, plastic surgeons actually, they are able to do and sign for it, but they don't prefer it because it's too long.
Takes long time.
Too long.
But for surgical, if we explain, we are
Forehead reduction.
Lift, yes, forehead reduction, frontal hairline lowering surgeries.
So bring it down,
Yeah.
brow lift.
We can take the hairline lower position, brow lift, total brow lift. And,
Oh, what is the difference?
and for the brow lift, generally we are calling it for the lateral brow lift.
Okay.
But sometimes with the aging process, total brow is going down with totally.
Okay.
Sometimes we have to elevate the medial side of it.
Okay.
There is miscommunication, maybe.
Actually, this is a very interesting knowledge, isn't it? And wow, yes, okay.
But generally, we are doing lateral brow lift also.
Okay.
For the
Is that cat eye or?
Yeah, not some part of it maybe. With the cat eyes procedure, we are changing the position of the out part of the eyes.
Ah.
But that's not only how can I describe it to you? Like we can't separate that part.
It's one part, so it's one whole thing.
It's a complete procedure with brow and the eyes corner.
Actually, it changes people a lot.
Yes.
What is the recovery like on this? Like, or because, you know, people ask us, when will I see the results?
Yeah, especially with lifting procedure, in first time we are doing little overcorrection. And it takes time for healing, especially in first 2 weeks, it's little more lifted.
Oh, okay.
And then when the sutures are absorbed and when the tissues are healed, the swelling will decrease and the tissues are healed, it will look much, much better generally after 1 month.
Okay. Well, we are only into the eyes. Imagine the face takes already 3-4 minutes to talk about on the procedures. So we are on to the face.
Yes.
So now you love actually you always confirm that you are one of the few talented surgeons that's able to do the how do you say it on the facelift? There's a technique, deep plane.
Plane first.
Okay, when I hear deep plane, I'm thinking, is it a deep flight? No, it's not that. So tell us
The differences.
because I see lots of surgeons doing the facelift, but then I see like yourself, for example, this technique using the deep plane technique, and there's very few of you in Turkey that is able to apply this successfully. And there's many claims, not only in Turkey but around the world, because I follow the trend, especially the trend in the 2024 and this year into it. I think we all agree that the trend has become more facial sort of rejuvenation, and I think this is part of the rejuvenation as well. So let's talk about the differences and then join the neck to it, and the age. What type of people should go think about it? Because sometimes we receive inquiries. People are 30 years old. They say my cheeks are low. What do you recommend? And the technique wise, and also.
I can tell about the little facelift procedure history.
Okay.
In first time, surgeons doing the facelift procedure only skin tightening, and in the follow-up, they are seeing enlarged scars, bad scars, and the result will not
Be satisfactory.
yeah, satisfactory. And then after that,
This is just a skin pulling. If
yeah,
they don't know.
first time maybe 1960.
Oh, okay.
I'm telling about that time.
The story of the facelift. Okay.
History of the facelift. Then after they are pulling the deep tissues, muscles, and maybe we are calling it SMAS, maybe you know.
It's a must, yes.
And then in first time they are plicating it, then after they are going with imbrication. And after that, with the time, they try to get more long-lasting result. And with that time, it's coming with some risk, but at the plate facelift procedure, we are entering the under of that SMAS layer.
Okay.
And then after that, we are just top of the nerves. It's risky because of that, because we are playing with that. The plane facelift procedure, we are dissecting the SMAS from the down structures. Then we are pulling the SMAS. We are actually pulling the deep tissues.
Okay.
Then after, we are just redraping the skin. We are not pulling the skin at that procedure. We are tightening the deep tissues.
Underneath.
Yeah, under the skin.
So that's called deep plane.
Yes. Then we are just redraping the skin with that tightness.
Okay. Well, of course, it's very small area to work with.
Yes.
And you have to have talented hand and talented fingers and experience, most importantly, and obviously patience and the time. How do you manage your, like, such a surgery? Because it's an important procedure for someone, you know, certain age, and they want to look younger and their expectations is high. And how do you manage that? How do you manage actually the patient's expectation from you, because you have face-to-face consultation, online consultation, preparation of that process. Then you prepare yourself for the surgery in the morning, you go in and there's what, how many hours? 3, 4, 5 generally?
Generally 4 hours it takes.
This is just the facelift?
Start to finish.
Okay.
We are not doing only facelift generally, because with the aging procedure, with the aging process, we are also losing weight, losing some volume of our faces,
Okay.
especially fat deposits. And we are generally combine it with fat injection. Also,
Oh, this is excellent. So you actually combine
yeah,
few other things with the prime surgery.
yeah. At this procedure, we are not thinking it only like a facelift, because aging process is going with not only saggy skin, it's coming with but also some volume loss.
Indeed.
Also,
I feel it on myself sometimes. You know, these cheeks dropped with the age more. So I feel like sometimes maybe if I should do like fat injection, but it doesn't work alone. So you combine it,
Yes.
and you look at it as a whole one case that you should approach and make it what they want. Yeah.
Yeah, we are combining with patient needs generally.
Okay. Okay. But of course they take suggestions as well.
Yeah, we
So
are,
fat is important. That means I don't need to lose this weight.
it doesn't working like
Soon we will come downstairs because you know I know you're excellent body shaper as well.
Yes.
I mean, very few doctors I have worked. You know, I was lucky to be part of this world 8 years now. Very few doctors that I have come across, surgeons actually, doctors, surgeons I came across like yourself are talented to do the face as well as the body and shaping. So this is one really big plus for you. I mean, I congratulate you for your you know experience in this. So this is how facelift surgeries takes, and the combination of face and neck. What can be combined with the you know in my face, for example, or in any patient's face? Yeah.
every patient needs different procedures, and we are checking generally firstly online consultation to prepare the package, but we are getting the final decision face-to-face consultation. And generally we are doing facelifts, and also eyes are getting age
Yes.
with the time, and we try to keep it more refreshed look. We try to get more younger look with that procedure. By the way, we are combining with the patient needs.
Of course, if they tell you
Yeah.
or if they ask you, we can combine with the upper eyelid generally.
Generally upper and lower, sometimes brow lids.
I hear lower to do the lower is harder than upper.
Yeah, sure. Because it's more complicated. If it's something going wrong, it can be ectropion, maybe you know,
Yes,
lower lid retraction.
of course.
It's hard to fix.
Yes, that's why not many people wants to touch it. But if there's fat deposits or that needs taking out, of course, you know you're attending to it. Yeah.
Yes. But sometimes we are also another way to do it. We are doing it inside of the eye
Oh,
without cutting the skin.
okay,
It's careless procedure, but skin has to be tightened.
okay. Obviously, better with the facelift and stuff like that. I'm always curious about the neck. How can the neck be tightened? Is it pulled up behind the ears like
Yeah,
the facelift? Generally, there is the neck procedure. Can it be done alone or combined with the
We generally want to combine it
With the
because-
facelift?
Yes, because if we tighten the neck, it looks how can I describe it, like stranger.
Ah, okay. So if you do the face and you don't do the neck, you look like alien.
Yes,
You may look like. So it's better to
do it.
join it and combine it together and get a fresh look.
Yeah, refreshed.
Okay, well that's a good thing. Anybody wants to ask anything about the face? Well, this is especially important for me now. I am aging, so you know, you are all young. I know you don't want it, but I will see you in 10 years' time. So, well, I think we're the first part nearly done. So we've only covered your expertise, facial part of the. Obviously, we haven't talked about the rhinoplasty. I think we should a little bit talk about it just to close the session one. Let's talk about the rhinoplasty, maybe a little bit ears, because lots of people have ear questions. Sometimes they have like, you know, funny shaped ears, or how do you call it this?
Prominent here.
Prominent, yeah, bravo. So let's talk about that, and then we will maybe come on to the rhinoplasty.
Yeah, sure.
Because rhinoplasty originally is the area of plastic surgeries, but obviously ENT world is also big in the rhinoplasty. Let's talk about that a little bit, and then in the session 2 we will talk maybe rhinoplasty and the combination of surgeries. Then we will go down towards the belly and the shaping.
Okay, especially if you are start with the ear, Also, with the time, ear is getting age. It's getting more saggy, especially the earlobe.
Oh.
Can be bigger and saggy,
Yes.
and we can reduce that.
It's like breast lift, yeah?
Earlobe lifting, right?
Earlobe lifting is called. Yes, we do that.
Reduction, maybe it would be more correct.
Correct.
And also, different procedure for the ear is the prominent ear correction. It's a problem for the especially.
Let's show it on the camera. If you have ears like this, is that a simple procedure for you?
Takes generally 1 hour.
1 hour. So in 1 hour, you can be free from this problem, and feel free to ask us. Dr. Erman Menekşe, we can take care of your problem. And lastly, let's just talk briefly, because we got for the first session maybe 1 or 2 minutes left. To close the session 1, I think we just came to the rhinoplasty. And let's talk about the rhinoplasty. And then in session 2, I want to really talk about the combination of rhinoplasty and other surgeries, what we combine or what we can combine, because there is lots of people that want to do combination surgeries, and I think it is one of the best combination surgeries, rhinoplasty and body part, and I will leave that to you to mention. Let's talk about, because it's plastic surgery world, rhinoplasty is actually plastic surgeons world. Let's talk about that. And you just briefly mentioned about the couple of techniques that are.
Yes. And we have 2 options. Generally, I want to do it with open way, but we can do it with also closed approach. If
Lots of people ask closed.
Yes, if patient asks for that, we can do it. But in the end, there is no differences between them.
Between closed and what is the advantage of doing it with the open then?
Yeah, open approach, we can dissect the skin more, and we can see the surgical field very precisely. We can every maneuver can be more precisely.
Of course, because it's open, it's in front of you.
You can see it, you can compare it with the other side, and it will be more
Balanced.
Yes, maybe the true word is that. But with the cutting of the columella takes little more time for the healing. But in the end, for the final result, there is no differences between them.
Okay. Okay, but your preparation would be because of the better tuning, let me call that better tuning, you would say it's the open technique, but if the patient is suitable and wants a closed technique, this is something that you are very comfortable with and you can do it. And just before closing it, I think there's a myth about some, especially on TikTok. What was the name of this thing on TikTok? Kinesio taping. We see lots of TikTok shorts or videos lately, especially Hazal is very curious about that. People are saying they put these tapes and in the morning they have facelift. Okay, so that means this is he's laughing. It's funny. Okay.
It's working like restricting the muscles working, right?
Okay.
When you remove that, it starts working and the wrinkles will come back, I think, in the
So you only have a facelift when you sleep? So when you wake up in the morning, no facelift?
You will be tightened in morning time, then after.
So that means
noon time you will.
That means you have to go to work with those Kinesio tapes to have a facelift, stay in front of your boss with the tapes, and at night taping does not help at all. So because doctor just confirmed that when you remove the tapes, all the muscles are relaxed and they start moving again. So the myth of your Kinesio tapes, Chinese do good advertising, huh? Are they Chinese make those tapes? I'm not sure. They do good advertising. I also bought lots of things from TikTok. They make you buy. They make you buy. Right. Session 1 is done. Okay. I'm so much looking forward to session 2 because now we're going to talk about rhinoplasty and the combination surgeries. See you soon.